Have you ever experienced low back pain? Maybe you're experiencing it right now, as well as a shooting pain that's leaving your low back into your hips and glutes, feeling like a pain in the butt. Maybe it's already traveled down your leg to your knee or even all the way to your feet. You know this pain can stop you dead in your tracks and possibly ruin all the plans you had for this day or this week. Here's the thing, sciatica and low back pain aren't just about sore and tight muscles, they're about a deeper issue going on, such as a pinched nerve, pressure on the discs, or even degeneration of your spine. Hi, I'm Dr. Adam Mead, and my goal today is to share with you what's causing your low back pain and the sciatic problems you're experiencing. More importantly, why ignoring it leads to bigger problems, and overall, how to help fix it and stop it from coming back. I find most people really benefit from understanding, say, what's causing their low back pain and where their sciatica is coming from. Low back pain is one of the most common reasons why people will visit their doctor on a regular basis. And sciatica is one of the most common types of nerve related back pain. This sciatic issue happens when the sciatic nerve itself, which is the largest nerve in your body, it gets irritated and it becomes compressed. This nerve starts in your low back, it runs through your hips and glutes, and then it travels all the way down your back of your leg. When it's irritated, it might feel, say, like a sharp pain or a stabbing pain, like a hot poker in your back. It may travel down your leg with that same sensation. Many patients also experience this numbness, tingling, or a loss of sensation in their legs at certain points, even a weakness in their leg or their feet, causing them to walk with a limp or affect the way they can even bend and lift. Really, the most common reasons or causes for this are disc problems. When the disc begins to bulge and becomes compressed or herniates, that puts pressure right on your nerves. When your spine misaligns, that creates inflammation around the nerve roots that leave the levels of your low back, putting pressure at the root of the sciatic nerve itself. Muscle tightness, muscle weakness are there around typically the glutes, the piriformis, even the hamstring, and spinal degeneration, arthritis actually narrow the openings where those nerves exit. So, a key issue and a more important factor is why you shouldn't ignore this. Here's the problem, pain is your body's warning sign, like a check engine light. And our goal is not to slap duct tape on it and ignore it, but really to find the cause of it. Because as that pressure on the nerve continues, the nerve problems worsen and actually can cause permanent nerve damage at the nerve root or even the spinal cord. This can lead to things like loss of strength in your legs and fatigue. It changes how you walk and stand, which causes both hip, knee, and ankle problems. It prevents you from lifting and bending and even getting a good night's sleep. I had a patient come in recently that when they threw their back out, it was just doing something simple like putting their boots on. Then they needed that spousal assist of the honey, can you put my socks on in the morning or even help me get my pants on? He thought really, like many of you, it would just go away with rest and time, but rest and time don't address the cause. By the time he came in, he was already limping. It was starting to weaken. He had tried all the remedies that many of you have tried between medications, pain creams, injections, ice, heat, even tried to get his wife to walk on his back. None of this was obviously addressing the cause of his low back pain or his sciatica. After we took a thorough evaluation of his spine and were able to put together a plan, the end result was able to get pressure off the nerves and relieve that back pain. He was able to walk and sit without pain, sleep through the night. He took a road trip all the way to Florida and back without taking rest stops every 20 minutes because of back pain. And more importantly, sleeping through the night so he didn't need a pot of coffee just to feel functional every day. He was even able to get back to the gym without limitations, be able to work out again, which many of you want to do, and back pain's preventing you from doing, and even able to lose, say, a few stubborn pounds. All great results of fixing the root. So the sooner you find the cause and address it, the faster your recovery will be. And the less likely permanent issues like arthritis will set in, really limiting how well you can correct your spine. So what do we do as a chiropractor? And what does that approach do? Well, from a chiropractic standpoint, our first goal is to find exactly where those nerves are being irritated. Starting off with an evaluation, a posture check, and really doing images to see what's working and not working with your spine, and actually to see the alignment of your spine can help customize a plan. Once we find out which joints are misaligned, stuck, and putting pressure on the disc and the nerve where bulging may exist, we use precise adjustments. We restore motion, reduce inflammation, and take pressure off the nerves to give you the relief you're looking for. But in many cases, the disc is involved. putting compression on the nerves, causing chronic low back pain. And this is where spinal decompression therapy shines, being able to give your back some breathing room and get pressure off your nerves. Spinal decompression is comfortable. It's a controlled traction system that gently stretches your spine, opening up those spaces. It almost creates this vacuum effect in your low back inside the discs, help pulling back those materials of putting pressure on your nerves and also allowing nutrients and hydration to get back to your disc so it can heal and restore. By combining both the specific chiropractic adjustments to restore alignment, the rehab exercises to strengthen and restore posture and alignment, and decompression to get stress off your nerves, you can relieve pain, restore function, and really prevent the disc issue from returning, ultimately giving you long-term relief. This also is complemented by what you can do at home. Just like I'd say a dentist tells you to brush your floss every day, you need to be taking care of these muscles. And some key things that we get most patients to do is if you're sitting often, changing the dynamic of your work environment, creating better ergonomics, or taking breaks throughout your day so you're not constantly putting pressure on those discs and nerves. Going over stretches and exercises, implementing the techniques of foam rolling, mobilization, and muscle activation so that you get your flexibility back. For some of you, you haven't touched your toes since about 12th grade gym class, so we need to get that flexibility back and strengthen your core so you hold your adjustments better and your spine is good and strong. Even using simple techniques. I know most of us have heard the saying, lift with your legs, not with your back. Changing the mechanics of your back will prevent future disc injuries, as well as keep that flexibility in your spine and great alignment. And most importantly, maintaining healthy posture. Posture is the window to your spine. Most of us don't want to end up with nursing home posture or that granny hump. So we got to correct the entirety alignment of your spine, take pressure off those nerves. Now, there isn't a substitute for care. These help with improving the overall function of your back and really help you heal faster and prevent this from coming back. So if you're dealing with low back pain and sciatic issues currently, whether it's a new issue or for something that's for some of you that's been nagging you for weeks, months, or even years, don't wait till it's really limiting your life. We offer a full evaluation in the office. We take x-rays, we do a full exam, and really look to the root cause of posture and spinal misalignments to see if decompression and chiropractic is the right fit for you. We'll find the exact cause of your pain, explain the options, and most importantly, give you a plan to fix this. You can reach out to the office by giving us a call or book or schedule that appointment online because you don't have to live with back pain, and let's get you moving as well as functioning again so you can enjoy your life pain-free. I'm Dr. Adam Mead. Have a blessed day.